Good afternoon, everybody. First of all, I want to tell you we live in a very special times, if you didn't notice. And from this presentation, we live in times where science can meet ancient knowledge, where science can expand into the wisdom of nature and learn from it. So I must say, from all the research I've done in the last 15 years, I'm very hopeful. So I hope this message will go across. We did a research into one formula for 15 years just to see its effect on cancer and immune system. This is where I work. It's in a cancer integrative center where we treat patients both with acupuncture and other means inside the oncology department. The hospital I'm working with is Sheba Hospital. It's actually a mega hospital. It has 20,000 cars coming in and going a day, or 1.5 million visitors per year. So it's like a small city. You need a bus to go around it. And it's the biggest hospital in the Middle East. So it provides care to many cancer patients. This is our integrative oncology unit. And it's very unique because it has both a clinical part, which, as you can see, we're trying to make it special in the way that there is a healing place inside the hospital, and also a preclinical laboratory where I'm very fortunate to work with an extremely good team and do really molecular research, so to see how herbal medicine affects the immune system and cancer, and I'll briefly go into some of the summary of our exceptional research. And I must say, when science meets nature, it's like two friends that didn't talk for some time, so they may start to like each other. I started to like more science, and I must say that Western doctors start to give much more space to natural medicine, and especially herbal medicine. And I think that the future of medicine is already here. We don't need to look for specific ways to treat and prevent cancer. A lot of it will come from combining what we know already for the cancer care. This is how our lab looks, and this is, you can see, the different herbs that we are studying. And this is the team. I'll mention just Zoya Cohen and Dr. Noach Samuels, who are very closely working with. There's two points of view in the world, microscopic and macroscopic. The Western world tend to look at everything in a microscope. And really, unless you know the mechanism of action, it's difficult to believe in something. Chinese medicine present much more a macroscopic view, and this is a unique view. See us part of everything. By the way, in biology, we have now molecular biology and system biology. Chinese medicine is very close to system biology. So we are not so strange in the way we look, but we are very unique in the way we understand men as part of something greater, and also in the way we understand the complexity of nature. We don't just look at disease, we look at the person, and we look how everything interacts with everything. When you go to the lab and you look like just a molecule, you forget the person. And this is a big difference, and I think this is a big message that we bring across back to science and medicine. Do look at complexity. Do look at the whole system. Everything is affecting everything. And that's why, if we're coming from an Eastern perspective, from Chinese medicine, we like complexity. We like the complicated situations, and therefore I chose to research a complex herbal formula, as you will see in a minute. So it's a multi-botanical. Western medicine will rather choose to research one molecule where you can really know what it's doing, you can control it very well. So Western medicine will follow the logic of science. And I think Chinese medicine brings a special notion to follow the notion of healing. Both can combine, and that's why I say we live in a special times. But definitely the message of healing is an important message, and it's a scientific message. It's not a different to this. So for 15 years, we've been researching this formula, and we have done it so far in 6 different medical centers, both in our center, in Europe, and in US. And that brings a lot of credibility, because if research is coming from one place, there is always, it can be a little bit altered. So we've done research in different hospitals, oncology institutes, universities, and really all over the world, everywhere, with the same formula, with the same production of herbs. And as you can see, some was done in America, in Miami Children's Hospital, in MD Anderson, and our recent publication is combining forces with the top oncologists from Harvard University. And that shows that persistence can lead to results, and I think it talks about everything in life, not just about research. You know. When we look at Western science, it's always a pyramid. It's a pyramid of evidence. The higher you go on the pyramid, the more your evidence are sound. The lower you go, there's still evidence, but they're very basic. And we have done with this formula everything, starting from mechanism, interaction with different drugs, going up to case history, going to the lab, and going to human research and double-blind randomized. This is the team. So I believe in teams. I don't believe in individuals, and as humans, I think we are one. So the more we work together as humans, the greater our effect. And that's the message also in Chinese herbal medicine. You don't hardly use one herb. You always use a combination of few herbs that are supporting each other. So this is the essence of our formula. That's their botanical name. And the main research eventually was in this multi-targeted effect. And I'm saying multi-targeted because Western medicine is now into targeted effects for cancer. I mean, you want like what we call smart bombs, you know, that they can recognize something very specific and go there, something on the surface of the molecule, some receptors, some biological component inside the cell. So we are looking very much, all Western biological medicine is like, we call it very much centered medicine and very much going into like one place. When we look at botanicals, we are looking at a multiple effect. So eventually we saw that with this one formula, we can see an immune effect, anti-cancer effect, and protection effect. Protection from side effects of chemo and other drugs. If you know any molecule that can do the three, I'll be very interested. But that's the real essence of Chinese medicine. And we are rediscovering what we know. But the more we go into the lab, I can tell you I had more and more surprises of how well it works in the lab. And it works time-wise and dosage-wise. So everything you can really quantify and see the effects clearly. So we are really undiscovering nature's wisdom rather than discovering a new molecule. And that's a very different path. Much less cost and much more effective and much more cheap eventually to the patient. So the scope of our research was protection from chemotherapy, immune effect, and anti-cancer effect. And this is how the formula was designed with herbs that are, each one of them was targeted to a different area. Like one was targeted more to what we call the qi and blood in the body, and it will affect more the immune system. The other was anti-cancer or antitoxins herbs that were more directed to the cancer, and other ones were more protecting the bone marrow and protecting the body. So now let's look at the first effect. This was the first randomized clinical trial we designed. And if you ever go into research, you have to be a bit innocent. Because everybody told me it will not work. You know, I mean, the reason, by the way, I started this research was a very, in a way, Buddhistic story. You know, in Buddhism, they say you have to bow to your opponent. The person who is the most hard and nasty to you, you have to bow to them. Because in the hospital that I used to work, it was a previous hospital, everybody were very open to Chinese medicine, but not the oncologist. And I asked them why. And the answer was simple: we don't believe it works. So I really set up on a research that will prove that it works. So we took patients, breast cancer patient undergoing chemotherapy, we randomly divided them into two groups. One took the herbal formula, one took placebo. This is the results. Quite amazing. On the placebo, if you look at anemia, hemoglobin under 10, around 50% of the patient had hemoglobin under 10. At the research group, the real group, only 18%, less than a half. But protecting anemia also means less tiredness and less fatigue and less difficulty in coping, and also adhering better to the protocols and the Western medicine. The same when we look at white blood cells and leukopenia under 3,000. Placebo 42%, and our formula 18%, and everything with statistical meaning. The same when we look deeper into neutropenia. So what we have seen, that the formula is really reducing the effect and protecting the bone marrow from chemotherapy. And because it's blood test, it's very clear to see. It's not questionnaires, it's a real blood test mission. We published it in one of the prestigious oncology journals. And just the last person on my list was my worst opponent in the hospital, Professor Marimsky, who is the head of the Oncology Association in Israel, and now became quite open and totally in a different position than where we started. And the rest of the group is oncologists, biologists, and other people that took part in it. So we saw that it reduced the chemotherapy side effect by 50%, both on white and red blood cells. It has a lot of meaning. So it's better adherence to chemotherapy, which is something which is very convincing to doctors, that we have something to offer that will make also Western medicine better. Less complication from chemotherapy, less secondary infection, and better quality of life. We really went deeper into quality of life with another group of patients, a prospective study, and we saw that 85% of the patients had a better kind of general quality of life, and then we look into fatigue, nausea, appetite, and pain. In everything, we saw a better quality of life of people who took it than comparing to people who just take chemotherapy. Then if we look at the anti-cancer effect, this was much more surprising. By the way, after this research, I know it's not so good, but I didn't sleep 1 or 2 nights because I was so surprised from the results, and they were really unusual. This was the first research we did with an anti-cancer effect, so we saw the formula has dose-dependent, time-dependent anti-cancer effect. We looked at the mechanism of action. We saw it's due to apoptosis. But the second research we carried about 4 or 5 years later, this is really the big surprise. This showed selectivity. And this is a real wisdom, which means that the formula, it's actually killing cancer cells and not affecting normal cells. I don't know any drug that knows to be so selective. I'll take you for a minute into our lab, and you look in the microscope. This is normal cells. We increase the dose of the formula, and the normal cells are very happy and thriving. When we take breast cancer cells and we increase the dosage, they are dying. The same with colon cancer, prostate cancer, and lung cancer and other cancers we tried. This is how it looks at the graph. Normal cells are very happy. Cancer cells are dying. And the same, this is for, I'll go one back. Oops, I'm hoping I'm going back here. So this is the same we see for prostate cancer, normal cells on the first row, cancer cells on the other row. You see clever formula. It knows to be selective. Later we try to find out how it does it. What is the mechanism of action? Because always eventually, okay, it's interesting, but how is it doing that? So what we are seeing so far, when we take just chemotherapy, it will kill both the good cells and the bad cells. There'll be no difference. Chemotherapy doesn't differentiate any good to bad. It's a toxic medicine. When we put with the chemotherapy the formula, it actually protects totally the normal cells, and the cancer cells are immediately dying. This is how it looks on a chart. Again, I'll go one back. This is normal and cancer cells. When you put chemotherapy, they're all dying in the same rate and the same time. When you are adding the formula to cancer cells and chemotherapy, they are totally protecting the normal cells, while the cancer cells are dying much faster. So this is a selective protection. So we saw a selective killing and then selective protection of the same formula. Again, we published it, so you can read all the publication in very good journal. So far we are looking at protection from chemo, anti-cancer effect, but even a selective anti-cancer effect. And when we look at the lab, protection of chemo, which is selective. And to me, this is a great appreciation to wisdom of herbs and natural product that can do it. The last thing we will look is the immunological effect, and then we'll pay a little bit to the mechanism of action and interaction, which is 2 main questions. So we carried the research actually, which was crossing over Israel and America. We looked into activation of blood cells, and we see activation of natural killer cells. sometimes even 4 times fold. And natural killer cells, they are the one that will kill cancer. So if they are more active, they are more effective. Eventually, and this is my next study is to show prevention of reoccurrence of cancer, because I see it all the time in the clinic. We give herbal medicine to patients that have high reoccurrence, and the reoccurrence stops. So definitely herbal medicine has a potential not just in helping the quality of life, but hopefully we can prove that it has a potential in preventing, definitely secondary preventive of cancer. And then the same when we look at activation of T cells and natural killer cells, we can know that one of the mechanism of action is through the immune system. Another one is, by the way, by reducing inflammatory conditions and other conditions which are precancerous in the body. And we published it again in a great journal with a big group of people. So, so far we've seen these 3 effects. And lastly, I can tell you we have a very special now way to show batch-to-batch consistency, which is one of the main problems with herbs, because they can vary in quality and vary in effect. So this is something we had to develop for our research. And last, I'll go very fast through the mechanism of actions and interactions. The mechanism of action is very interesting. Again, when we look at normal and cancer cells, this is after 24 hours, you will see the PARP, which is one of the enzymes that help to repair the damaged DNA disappearing in the cancer cells, but not in the normal cells. So in blue, you see normal cells. The PARP, this enzyme, is still there. In the cancer cells, it disappears. And cancer cells are very weak cells, so they need to repair all the time. If you take this repair mechanism, they die very fast. And we see the same thing, time-dependent and dose-dependent. Furthermore, we saw that this mechanism is very much due to looking at the activity of ROS, reactive oxygen species. This was our next research. We took all the herbs. We looked which one of them are working through this mechanism and which one not. You can look at this publication. It says 27 herbs. And we analyzed the herbs and which one are working through reactive oxygen mechanism and which one are working through other mechanism. So the last thing is the main concern in oncology is, will it interact with our Western drugs? And this is, by the way, it has 2 options. The simple answer, just don't take them in the same time. Most of the chemo will go out of the body under 24, 36 hours. So if you even don't take on the same time, you totally clear this potential of interaction, but actually the potential of interaction may be positive. That's what we are showing. So probably it's much better, as we did in our research, is to take it together. We took 10 different types of cancer, 10 different types of chemo, and we look at the interaction. A lot of lab work. It looks with a lot of graphs, but you can see different cancer cells, different interaction, and no negative effect. Published also last month, so you're welcome to look at the publication. The last thing is under publication now is the synergy with radiotherapy. A lot of time patients are told don't take any medicine which is reducing reactive oxygen species in the body, because that's the way the radiotherapy works. We have actually found a really great synergy between them two, and in all, again, time-dependent, dose-dependent, not just no interaction, but synergism. Lastly, I will put it together, and again, our research that was published just about a month ago about the botanical formula and its multi-targeted effect. And what we are doing every day in our clinic is multi-targeted effect. We are actually affecting a lot of mechanism in the body. And this is the way Chinese medicine works, both acupuncture and herbal medicine. To see the proof of it is very promising, and to see the proof of it, I think, will help to put the road into changing the way cancer care will happen. So this is what we've seen, and I would like to finish up with one of my mentors who is French, so you may know him, Father Lar, and he said a lot of very deep things about Chinese medicine, about wisdom, and he said by returning to the classical root of Chinese medicine, we can make a truly significant contribution to the medicine of the future. And I think this is a real message, because the medicine of the future which is not so far from us, will be very different than the medicine patients receive now in usual care, and a lot of it is due to the work of all of us. So we move from this microscopic view to the macroscopic view, and we are combining the art of healing with the science of medicine. And I'll finish up with a quote from Mahatma Gandhi, because that's what happened to everybody who does something new and strange. They say first they ignore you, they laugh at you, and then they fight you, but then you win. So I hope we are on the last stage of this message. Well, wishing you the best of health and healing. Thank you very much.
Thank you. And we wait to see the next step of your study. Thank you very much.
Thank you.